Hey, I'm Dr. Ziad Assi, MD, here in Sarasota, Florida, Precision Health Concierge Medicine. I am co-owner and co-founder here. I started this practice with my partner, Dr. Mullen. We practice lifestyle medicine. We practice personalized medicine. We are a luxury concierge medicine practice. The reason why we practice in this manner is because we get to do medicine as we see fit. We don't have to answer to insurance companies. We get to spend more time with our patients by having a membership model. We get to form those relationships with our patients that really matter. And one of the things that I tell people is there are no secrets in medicine. All of the information that we have is readily available online. The past 5 years, we have seen an absolute explosion of information that's readily available. The difference is I know what's real and what's not. I spent 30,000 hours getting my medical degree, going to residency, learning how to be a doctor, learning how to digest this information. I've taken the time to figure out what's real and what's not. And that's the biggest challenge that we have right now as physicians. I can tell you a story of a guy who came in and told me, hey, doc, I'm on retatrutide. And I was like, well, probably not. And even if you are, God knows what's in that vial because that drug is not actually available on the market. Oh, I got it from a trusted source. And, I sat down and I talked to him like, we have better alternatives rather than just going on the web and getting God knows what. Literally that same day, I go to a conference and I'm talking to a doctor and he's like, yeah, I'm on retatrutide. And I was like, what? It was literally the same exact story. He got caught up in the same exact hype that the regular guy did. And so I tell that story to show how complex medical science has become. 20 years ago, it was not like this. The doctor knew what they knew, the patients didn't, and you usually listen to the doctor. Now you have AI, you have social media, you have all of these inputs that you're getting, and God knows if what you're being told is true. The biggest problem right now is marketing. People are always trying to sell you something. I'm not sitting here trying to sell you something. I'm sitting here trying to tell you what I do and why I do it. That's it. If you want to join the practice, come join. If you don't, it doesn't matter to me. That's perfectly fine. What I would like to happen is I would like to have other doctors step out into medicine and start doing what we're doing. One of the things that I want to build is I want to build a better practice so that I can be an example to other doctors so they can say, yeah, I really can do that. I really can break away from insurance and I could sit there and I could spend time with my patients. And we're trying to build that system, right? It's not just here, Precision Health. We're trying to be bigger and better than that. And part of the reason why we do what we do is because we're not satisfied with good enough. We always want to achieve the best of the best. And as a principal, what we're doing now, some of the stuff is really niche. It can be, some of the tests can be really expensive, but that's how technology works. It always starts as a really expensive, really selective technology, and then it bleeds down into, more mainstream medical science. It's the same thing with cars. It's the same thing with computers. Everything is like that. And so right now what we're trying to do as physicians is we want to be involved in these really cool things. We want to figure out what the truth is and how we can do better for our patients. We have patients with heart disease and the answer isn't just, oh, let's keep checking your cholesterol and give you medications. Let's do the advanced cholesterol panels. Let's do the cardiac CTA. Let's find out your plaque analysis and do, this combination of therapies and lifestyle to make sure that we're getting you the best of the best, including reaching out to some of these pharmaceuticals that are doing clinical trials that are making breakthroughs. We actually reach out and try to get our patients involved in these trials. That's what a good doctor is supposed to do. Unfortunately, you probably don't have a good doctor because the medical system is made that way. Your doctor is struggling to keep the doors open because they're busy checking boxes for insurance or listening to whatever corporation has taken over their practice. I have patients who tell me literally they signed up for a practice. It took them 6 months to get in. By the time they got their appointment, the doctor was a different doctor. That doctor had already been fired or quit, and they're seeing a brand new person that knows nothing about them. So if you tell me a doctor can see somebody in 5 minutes and spend 10 minutes reviewing their chart and know everything about them, I'll tell you it's an absolute lie. That's why medicine is so bad right now. And so what we're doing is we're trying to change that paradigm. We're trying to make it using technology for one, using time for the other. I can't tell you how many patients have come to me and said, hey, I've been going to a doctor for 5 years and they haven't figured this out. You figured it out in 3 appointments. And I say, yeah, because I have the luxury of time. I had the luxury to sit down and go through all of your prior medical records. I had the luxury to sit down with you for an hour personally, go through your systems. You tell me what's accurate, what's inaccurate. And then 3, I was able to use my medical knowledge to go through and try to figure out exactly what was going on. That's super satisfying for me, but it's even better that the patients are getting good outcomes. This isn't about me and how I practice medicine. This is about patients doing doing better in their journey to achieve their optimal health. And that looks different for everybody. And I know that. I'm not going to treat a 30-year-old the same way I'm going to treat an 80-year-old. So why would we be giving them the same labs? Why would we be giving them the same treatments, right? There's a lot of nuance in what we do. And it's not just in the outcomes that we have, it's what patients actually want. Listening to the patients is something that just doesn't happen in medicine anymore. There's reasons for that because, you know, the insurance companies and the big medical systems, they're in it for money. It is what it is. Obviously, we're businesses, right? We have to make money. There's a reason why, or there's a way that we keep the doors open. We have to pay our employees. We have to pay our insurance. We have to do all those things just like everybody else. So yes, it is a business, but if you put money before you put the quality of care, before you put the relationships, you're never going to have a good system. And that's exactly the opposite of what we do. That being said, what we do try to do is we try to make sure that we have really good relationships with our patients. We know everything about you. We know more about your medical history than you do. So when you come in, it's not like, you know, somebody's just opening up your chart for the first time again. We know who you are. We know what you want, what you don't want. We're able to personalize that treatment plan to you. It's not going to be the same. Husband and wife, twins come in, even if they have different preferences, right? And so what we want to do is we want to make sure that we deliver the best medicine possible in the most personalized way, and that takes a relationship. Our doctors have limited panels. We don't see 3,000 patients like the regular doctor does because we only have a certain amount of time. Everybody's time is limited. That's the most precious resource. And what we do is we partner with our patients to make sure that we have enough time for each and every one of them. Our panel sizes are different because we have different complexity of our patients of different ages, we have families. So everything that we do, if you ask me, what it looks like for the average person, there is no average person. I'll tell you what it looks like for you. And that takes a lot of getting to know each other. You have to like me, I have to like you. That's the whole point of concierge medicine. It's a relationship. And that's what medicine was meant to be. Medicine was meant to be a patient-doctor relationship. That relationship doesn't even exist anymore. It's so far from what it used to be. So there's a lot to what we do, and there's a lot of, reasons why we do things differently. But the main reason is because we want to be better, and we can be better.